You're watching Channel 3 this Wednesday morning. I'm Alexandra Montgomery.
Good morning, I'm Dom Amato. More industries are trying to figure out what to do with artificial intelligence.
That includes the medical field. Channel 3's Melissa Cooney joins us live with how.
Dom and Alexandra, I spoke with UVM Medical Center and Rutland Regional Medical Center about the role AI could play in healthcare, the pros and the cons, and where they see the future headed. Artificial intelligence isn't a huge player in healthcare operations right now, but it's in the forecast. At UVMMC, infectious disease specialist and medical ethicist Dr. Tim Leahy says use of AI is in the exploratory phases, but he doesn't know of an established AI routine in the hospital.
But I can think of just a myriad different examples of new ways people are exploring right now. So I suspect the years ahead are going to see a lot of change.
Leahy says he imagines patients could ask ChatGPT to give an explanation of a conversation in the physician's office and help define medical terminology. And doctors could use it in the triage setting to make healthcare more efficient.
Our clinicians right now are overburdened with documentation requirements. And wouldn't it be great if the doctor could just have a conversation with the patient and then AI could sort of summarize it in writing like a great scribe might.
But Leahy says users will have to proceed with caution, the same way they would with Googling information.
I also think that patient privacy is something that we have to be really careful to protect with AI. You can imagine that this is the perfect information gathering machine and may not be the perfect information protecting machine.
In a Rutland Regional, Chief Medical Information Officer Dr. Rick Hildebrandt says he hasn't heard of his colleagues using it in a meaningful way, but has heard of it being used elsewhere for tasks like a prior authorization letter, which deems care necessary. He notes implementing AI in full force would take a lot of work repersonalizing the hospital technology that already exists. But he says it could be a great tool to get a faster and more accurate diagnosis.
AI could help in those areas too. Hey, we know, the system can know you're treating a pneumonia. They know what your culture information is, what organisms you're trying to treat, or whether you don't know that, and can say, hey, you ordered, this antibiotic, but based on the patient's kidney function, it should be this dose. What do you think about that?
But like Leahy, Hildebrandt cautions AI can't take the place of your doctor.
It's nothing more than a tool, and it's not a replacement for going to see your doctor when you have a medical problem. I mean, we're not even close to, that level of thing. And that's where it can be dangerous.
And Leahy emphasizes that the pandemic has taught a lot about the healthcare field for virtual medicine in recent years. He says in some ways it's great, but has also been made abundantly clear how important human interaction is with their physician, especially when it comes to getting a specific diagnosis. Live in the newsroom, Melissa Cooney, Channel 3 This Morning.